Hello, my name is Martha Engel, and I'm going to talk to you today about home hemodialysis and about options with regard to hemodialysis. By way of introduction, I'm actually an interpreter educator and a sign language interpreter. But for me, this is very personal. I have a loved one who's on dialysis, and I am the person who does that dialysis for them. It's an avocation for me. So I wouldn't call it really a hobby, but it's a part-time job that takes up a considerable amount of time, but is well worth it. So I'm just going to start by briefly talking about dialysis options. This is for people whose kidneys are no longer functioning at sufficient levels to not need dialysis. You can be in a certain level of kidney failure and you can still function and do okay. But once you reach a certain point, which is considered end-stage renal disease, ESRD, end-stage renal disease, you need dialysis in order to survive. You need to continue to clean the blood from toxins and do the functions that your kidneys do in order to continue to live. There are a variety of options for this. There are in-center options and home options. And home options are a relatively new thing. But in-center, you can do daytime hemodialysis, which is typically 3 days a week, or you can do nocturnal hemodialysis, which is typically 3 nights a week. And at home, you can do peritoneal dialysis, which is using your own body cavity to do the filtration of the work of your kidneys, or you can do hemodialysis. And there are various reasons why somebody would be able to do one or the other, so I'm not going to go into all of those details, but I do want to talk more specifically about hemodialysis options and the options of doing hemodialysis at a dialysis center versus doing dialysis at home. So what you see here on this slide is a typical dialysis machine, in-center machine. And really, it looks daunting, but it's just a big giant pump that measures pressures, measures whether there's air in the lines, measures that the right amount of dialysis fluid called dialysate to blood is going through the system. And the machine itself doesn't do any of the blood filtering. What does the blood filtering is that cylinder that you see on the right-hand side of the machine, and that's called a dialyzer or a filter. And basically what happens is a fluid called dialysate travels up the outside of this filter while the blood travels down the inside of this filter. And through an osmotic process, it removes toxins from the blood the same way that your human kidneys would do. It's not as efficient as the human kidney, but it's good enough to do what people need to sustain life. So this slide talks a little bit about how dialysis works. I don't want to go into all kinds of gory details about that, but I do want to give you sort of an overview. Everything outside of that person's arm that you see on this slide here is stuff that happens in the blood lines or in the machine itself. So basically the blood is taken out of the patient, goes through a pressure monitor to make sure that there's not too high a pressure on the patient and going into the machine, goes through a pump. Anticoagulants are added because when your blood is circulating outside your body, there's a tendency to clot. So they'll usually give you some kind of anticoagulant like heparin, if you can take it, to keep the blood from clotting in the machine. Pressure monitors, and that thing that's called a dialyzer there in the picture, that's the filter that I showed you just recently on the right-hand side of the machine. Air detectors and air traps, things to keep air from going back into your body. You can get a little bit of air in your body. You know, if you've ever had an IV and seen those little air bubbles, a few air bubbles, they aren't going to hurt you, but you can't take a big column of air. It'll cause an air embolism in your heart, and you won't be doing too good after that. So the machine prevents those kinds of things from happening, returns the clean, filtrated blood to the body. Now, the blood doesn't get all clean in one pass. Your body has, I can't remember the exact number, but about 7 to 10 liters in an adult body of blood. And it needs to cycle through the machine probably about 7 to 10 times in order to clean it sufficiently. So dialysis patients have to deal with, some dialysis patients, their kidneys still make urine, and so their bodies still remove fluid from their bodies when they drink and they eat, but the fluid is not, the urine isn't filtrating the toxins out of the blood the way that it needs to. So some patients need the machine to also help with removing fluid from their bodies to take over that part of the kidney function too. And kidneys regulate fluid in the body. They also actually create hormones that regulate your blood pressure. So there's a lot of different intricacies involved in how the kidneys function and how dialysis works. But dialysis patients need to have what's called a dry weight. They tell how much fluid you have on by weighing consistently the same from one day to the next. And you can imagine if you have a big meal or something like that, that can make that number a little bit difficult to figure out and a little bit elusive. Dialysis patients also have to watch their diet very carefully typically, because the things that are filtered from the blood include potassium, sodium, creatinine, and phosphorus. And the dialysis machine, the filter, is only so efficient at actually removing those things from your blood. And so the only other way you can really regulate those is by being careful to take those into your body. And if you look at those 4 substances, they're in everything. So dialysis patients have to watch their diet very closely. Dialysis patients also, because sometimes the red blood cells in your blood stick to the inside of the filter in the machine, their hemoglobin or their red blood cell count tends to drop. So they have to get a drug called epigen or erythropoietin, which will encourage the bone marrow to produce more red blood cells, because the red blood cells carry oxygen, so they're really important, of course, to your ability to not be short of breath, to get sufficient oxygen circulation to all your organs and so forth. So it's also important to remember that a normal person's kidneys work 24 hours a day, 7 days a week, 365 days a year. They also work on leap year. Your kidneys work all the time. A dialysis patient, while they may have some partial function of their kidneys are only working at their optimal when they're hooked up to the dialysis machine. This is another chart that explains how dialysis works, and it's kind of busy, but I'm throwing it up there for you to look at later if you have any questions about how this process actually works. Most dialysis patients have what's called a fistula, where they join an artery and a vein together surgically, and they use that by sticking needles to remove the blood and return the blood to the patient. Some patients have a catheter called a central venous line. These are very dangerous, though. They're very prone to infection. If they get infected, it goes right into your bloodstream. So typically the fistula is seen as the safer option, and patients are very strongly encouraged to use that as their route of dialysis, except in an emergency when they first start dialysis, for example. So what you see on this slide here is a typical dialysis center, and this one looks really very nice. It's open and spacious and clean, and there's nobody there, except it looks like there's a nurse there. But you can see there's not a lot of privacy. You don't have a separate room. The machines are all lined up in a row, and I will tell you that they can be very noisy. They alarm anytime there's a high pressure, which can happen just if somebody shifts their arm a little bit, or if there's air in the line. The machines are very sensitive to that. Even though it requires a lot of air to really hurt you, the machines are very sensitive to even tiny little bits of air, and they make a lot of noise. This is actually a picture of nocturnal dialysis. Again, you see, even though you're there, you're staying overnight, and ostensibly you're sleeping, you don't have a lot of privacy. You don't have your own separate room. You're going to have one nurse and a dialysis tech taking care of 4 patients, and they have to be able to keep an eye on all of them, so you're not going to have a private room. This is more typical of what a dialysis center looks like for the daytime dialysis. In this picture, you can actually see patients are sitting in their chairs. They're all got their TV on. Notice that the TVs are all on different stations. So a lot of centers require patients to use headphones to watch television, but you can see that it's much more crowded. And for many patients, it often will feel like this. They feel like cattle going into the center, being hooked up to a milking machine, doing their time on the milking machine while they bide their time. Usually there are better things to do than just chew their cud, but this is what it feels like. It can feel very assembly line-like for the patient and very dehumanizing in many ways. So there are pros to doing dialysis in center, though. One of them is that the nurses and techs do all the work for you. You show up at the center, you sit down in the chair, you get put on the machine by somebody, you leave it all behind. Most centers have Wi-Fi, you can do something on your iPad, or you can watch television, or you can read a magazine or a book. And you're under constant surveillance of trained healthcare providers. They're watching to see if anything goes wrong, they know how to respond and react. And there's a social aspect. There are other patients that have kidney issues, and there can be a support group aspect to that situation. It's 3 times a week, 4 hours each time. You come in, you sit down, they hook you up, you run, they take you off, you leave. And that can be convenient, sort of, except that most dialysis clinics work in shifts, so they will typically have morning, midday, and afternoon shifts, unless you're doing nocturnal. And they will have, you'll go 3 days a week. So you'll either go Monday, Wednesday, and Friday, or you'll go Tuesday, Thursday, and Saturday. And that can be convenient, but it's scheduled. The con is that you're not in control of that schedule. Once you have a seat reserved for you at a dialysis center, you have to show up for that on time every time. And if you don't show up on time, they can get a little grumpy because it can set their whole shift back and really screw up all their patients' schedules because they're pretty tightly scheduled. You know, like all those cows lined up in the milking machine, if an empty seat is there, they're going to want to use it. A con, it's 3 times a week, 4 hours a week. That is not what your normal kidney function is. You know, it means your kidneys are only working 3 times a week, 4 hours a week. And because of that, you take on a lot more fluid in between treatments. You have to be very careful of your diet because your blood's not being cleaned on as regular a basis. And it's very noisy. You don't have any privacy. And you have care providers, nurses and dialysis techs that are going from patient to patient, taking care of them. And understand, if you need dialysis, you need it whether you've got the flu, whether you've got a stomach bug, whether you've got intestinal issues, you still need your dialysis treatment. So people go even when they're sick. And so there's a much more risk of patients conveying illness to one another and people getting sick in dialysis clinics. And you don't have control of your schedule. You've got to get there no matter what the weather's doing. So if there's a snowstorm, you still have to figure out how you're going to get to the dialysis clinic. So because of all of these things, the medical outcomes aren't as good. Some people say in-center dialysis is not enough to keep you living, it's just enough to keep you alive. And the centers, because of privacy rules, which always struck me as odd, are very strict about visitors, most of them. They won't let family members come back to be with you. And yet, you're sitting in a chair hearing the doctor talking to the patient next to you about their care plan. So I always thought that was a little bit odd, that particular rule. So the other option, home sweet home. For this person in this picture, home sweet home is on their boat. Looks pretty good if you got to be on dialysis, doesn't it? For this person, home sweet home is, it looks like maybe their den with their grandchild once they're hooked up to the machine, their grandchild on their lap. For this person, I don't know whether the dialysis centers actually recommend this, doing it outdoors, but this person is doing dialysis by their swimming pool. And for this person, they're doing dialysis while they work. So if you have to be hooked up to this machine, having your blood cleaned, isn't it better to be productive and getting things done and enjoying what you can around the edges. So there are pros and cons even to home dialysis though, but the pros are that you have a lot of freedom. You don't have to go on a specific schedule. You can do dialysis in the morning one day and in the evening the next day, as long as you do it once every 24 hours. You're in better control over how much fluid you remove. If one day you feel, I'm just feeling a little nauseated, I don't think I want to take a whole liter of fluid off, as long as you catch up with it the next day, you can take charge of what your body's natural system is doing. You get to choose the time and the place. It's 6 days a week. So that's a pro because it's more similar to what your natural kidneys do, and it's more gentle. Because of that, because you're doing dialysis and cleansing the blood more regularly, you have fewer dietary restrictions and less fluid intake restrictions. You have privacy. You can have visitors. You don't have loud noises and machines going off all over the place. And you have better outcomes because it more closely simulates the real kidney. And because you're not surrounded by people who are sick all the time, you have less risk of infection and contagious illness. And you can travel with the machine. I'll talk a little bit about that later. And you don't have to get up in a bad snowstorm and get yourself to the center for your dialysis treatment. The flip side of that is that it's a big responsibility. There are a lot of supplies you have to manage and keep an inventory of. You have to make sure you don't run out of important things that you need. You have to have a trained support person to provide the dialysis for you and to monitor the machine, because when you're hooked up to the machine, if there's an air alarm, you can't respond to it yourself. The pro is that it's 6 days a week, but that's also a con, because 6 days a week is a big commitment. And you have to be able to stick yourself with needles. And you have to, if there is bad weather, you have to worry, is my power going to go out while I'm in the middle of treatment? And am I going to have to do some kind of manual rinse back of my blood in order to manage during a power outage? You have to maintain the equipment and do systems checks and contact tech support when you have problems with the equipment. You have to run your own labs. You have a centrifuge in your home where you pull tubes of blood and you spin them and you send them off to the lab for analysis to make sure your dialysis is working adequately. And so you have to have good communication with your clinic, your doctors, and your tech support people at the dialysis clinic that oversees your home treatment. But the medical benefits are that you have shorter, more frequent treatments. You have reduced shifts of fluid, which means you have better control of your blood pressure without medications. Your appetite is improved. You have fewer fluid and dietary restrictions. You recover more quickly after treatment because you're not removing so much fluid that you feel dizzy and horrible. You have better physical and mental health because you have more control. And you get to have a decision about who gets to be with you while you're having your dialysis treatment. Less stress on your heart because less ups and downs of the fluid in your body. And so, overall improved survival rates. An NIH study showed that when patients came back to dialysis after their 2 days off, when they were going to the clinic 3 days a week, one of those times you're going to have 2 days off, that there was a much greater increase in mortality at that point because of heart attacks and hospitalizations and other problems associated with the major changes that your body goes through. And so home dialysis allows you to be more consistent and maintain homeostasis better. So you can travel with it. I think I said before there are a lot of supplies. This is my car with a weekend worth of dialysis supplies. Everything in there is necessary except for those 2 little bags. That's what our clothes and toiletries are in, but everything else is related to dialysis, and that's with the back seat down. The machine itself, the cycler, weighs approximately 75 pounds. It's heavy. You need help to carry it and put it in the car. And the machine that's the cycler is the thing that looks kind of like a laser printer in this photograph. On the right-hand side, it's set up for home use, and it makes the fluid, 60 liters of dialysis fluid, in that black box at the bottom. On the left-hand side, that's set up for travel usage, and the bags hanging on the pole are 5 5-liter bags of that dialysis, the same dialysate, the same thing that's in the black box at the bottom. So you have to travel with all of that, and it's a lot. You can request to have your supplies shipped ahead if you're going to be away for more than 3 days, but if anything less than 3 days, you have to take them yourself. You have to work with the airlines and the cruise and the train to arrange for delivery and transport. But it is covered under the Americans with Disabilities Act. So you can assert your rights under the ADA to have those things taken care of. But I put this funny cartoon in. This guy's trying to travel with what's actually an in-center dialysis unit. And the flight attendants say, "I'm sorry, I sympathize with you, but I'm afraid your dialysis machine can't be viewed as carry-on luggage." So all in all, it's also possible to take weekend trips, because you can do dialysis on a Friday morning, travel where you're going, spend Friday night, stay Saturday, have Saturday be your 1 day a week off, come back on Sunday sometime in the afternoon, do dialysis Sunday night, so you can have weekends away without any thought of your dialysis machine or your equipment. So all things being equal, home dialysis, in spite of the responsibilities, is a really incredibly good option. Very small percentage of people on dialysis actually do home dialysis, but if you or a loved one you know is in the situation of needing kidney dialysis, I strongly encourage you to seek out what options you have locally in your community for doing it at home. Thanks.